You're welcome to my channel. Let's quickly go through all the facts about Prinzmetal Angina. It's also known as vasospastic or variant angina. Without further ado, let's go. Please, let's take note of the fact that this condition is easily misdiagnosed. And why that? It is so because it is difficult to diagnose it. And the reason is not far-fetched. Many people will focus on the possible differential diagnosis, but don't bother yourself. I have listed the differential diagnosis even right here, and how to make the accurate diagnosis all right here. Like I've said, it is vasospastic angina, but has other names as Prinzmetal or variant angina. The pathophysiology could be summarized as there is spasm of the arteries of the heart, meaning spasm of the coronary arteries, and the arteries will be narrowed momentarily. The clinical features here will be chest pain or chest discomfort, but note this, at rest, and occurring between midnight and early morning. It may be associated with cold weather or cold drink, and it could be reoccurring. Each episode will be for a short time, between 5 to 15 minutes. Still on clinical features, it's relieved by nitrate, not triggered by exertion, and not necessarily relieved by rest. The EKG, if taken during the attack, will reveal ST segment depicting ischemic changes. The affected population will be essentially anyone, but more in younger age group, anyone 50 years or even younger. It is common in women than men. Asian population will likely have the impact the more. The record is there in Japanese population, more than Europeans. People with history of migraine, yes, they may run into this. And anyone with renal disease may also run into this. But no history of coronary artery disease in this individual, and there may be no risk factors or few risk factors for coronary artery disease. It may be triggered by cold weather, cold drink, street drugs like cocaine, amphetamine, and marijuana. That is why you don't take all this stupid stuff. Alcohol, smoking, certain medications like sumatriptans or ephedrine, certain procedures like catheterization with hypoventilation and vascular maneuver. How can we make diagnosis? We will take history, going through everything I've said before now. You can have EKG done preferably during an attack. That will show you exactly what's going on. You might do cardiac enzymes if you have the time and money to rule out myocardial infarction. Magnetic resonance imaging, coronary CT scan, cardiac catheterization could all be done in advanced centers and for the peace of mind. Stress tests will not be diagnostic, but it can lead you to do more things, like having catheterization done using certain medications that could induce spasm. Differential diagnosis. Remember, it is difficult to diagnose. You have to rule out myocardial infarction, aortic dissection, esophageal spasm, gastroesophageal reflux disease. It might be trauma or abuse. Is there shingles here? Any costochondritis? Is it cocaine toxicity? Are we dealing with pericarditis? Could this be unstable angina? Any anxiety here? What about panic disorder? Treatment. Nitrate, nitroglycerin will help. Calcium channel blockers. But men, if you're on nitrate, no Viagra, no Cialis. No BZ1 selective here. This is not the time for metoprolol. No. In fact, no BZ1 and beta-2 non-selective. If at all you are going to use any medication in this group, you must go for non-selective beta-1, beta-2, and alpha-1 blockers like carvedilol, labetalol. But discuss with your cardiologist, please. Complications. There may be sudden death. Maybe myocardial infarction, then arrhythmia, and even heart failure. In conclusion, if you still have any confusion as per making accurate diagnosis of Prinzmetal angina, please discuss with your cardiologist. It is easily misdiagnosed, or I would rather say it is difficult to diagnose. With that, I come to the end of this short presentation as per vasospastic variant of Prinzmetal angina. Is the same condition that has different names. Thanks for listening. Please remember to subscribe to my channel. Remember to share this with all your friends on your platform. I appreciate it.